and welcome everyone to today's session. Today is our 1374th continuous webinar. And thank you all the participants for joining with us. And thank you all the faculties for sharing your knowledge and your time. The participants also, you are spending your time here, and your enthusiasm inspire us to conduct this webinar. Thank you so much. And today's our guest is Dr. AAMIR Malik from Pakistan. He has joined. Dr. AAMIR Malik is here. Okay, AAMIR Malik is our IFPH, the IFPH member of Pakistan chapter, and he is leading the Pakistan chapter. And he is B.Sc in chemistry and DHMS and RHMP, and he has 26 years Medical Herald newspaper. And he is the member of Supreme Council of IRAW and member of ambassador of the health and humanity of the same IRWA UK, and MS scholarship from Mountain William University, USA. And today he is sharing some of his clinical experience. Dr. Hubert?
Yes.
Dr. AAMIR Malik has not joined it?
No. I cannot see him.
Yeah.
Now only 14 people are there.
Yeah. Yeah, not at joined. Okay, Dr. Danesh. Okay. Dr. Danesh?
Give me that he is there from 7:30 itself, but might have left due to network failure. Let us wait for him. And
Constantly they have trouble in the network, I think.
yes, the Pakistan network is very poor nowadays. Yeah. Yesterday also we have the same problem with Dr. Tansila.
Mm-hmm.
Same thing has happened. Let me check once again.
Okay.
Yes, last time, as everyone know that he had an injury to his head some months back, and he was there in the ICU for some days and had an operation, surgery for that, and it was a critical condition by that time, and he undertook a lot of medicine, and thereafter he took homeopathic medicines too, and which then now he's back as the same person as what he was some days back, some months back. So he is fully active nowadays. He has joined some of our sessions, some recent sessions. But unfortunately, still last week, some 30 days, 20 days back, I think there was a session. The same session was supposed to be taken, but unfortunately he couldn't connect during the time. As a result, we have a discussion with Dr. Beatrice, who was there, and that was a discussion on acute management of disease also. Management of acute diseases. We are able to communicate in that way. Today also sometimes we may have to go in that way. So if the condition not favorable, I hope some are joining. Let us know whether he is joining or not. At present, he is not here in the list.
Yeah, and even not picking. I mean, the call is also not connecting.
Yes, his Yes, his network is not working. That's why we couldn't connect him. Anyway, let us go for some discussion.
Okay, sir.
Yes, last time also we have a discussion on these chances of homeopathy in mental conditions. As we know that every homeopath take a case in details when it come to today also I got a patient and she was a lady just 33 years old having three children. So she came to the clinic with some obstruction in the throat. She was very slim, and when I took the case, I found that she had a very troublesome life in her home, as the mother-in-law is not also is a person who is always criticizing her for everything, and sometimes she abuse her with some bad words also. What happened was that the patient husband is a driver, and he wanted to buy a lorry, what pickup van with his friends, and after taking that, he was in that business was totally collapsed, and she lost 30. She 30 what power 30 mean not grams. Almost all this gold were there with him. With her was lost for that particular business, and thereafter they become bankrupt, and she is now staying at the at her home. So this is the condition. That really she is not at all happy. She is always worried, and even though her husband is coming to her home, but not able to have any in sexual relationship also. He is not interested in all those things nowadays because, as you know, that whenever there is a problem in the home, naturally it affects in everything, not only in food habit, but even in the sexual aspect also. So all those things makes this lady in a terrible life, and because of that she is suffering. So what can be the remedy? This is what a homeopathy doctor need to do. I just have a very nice talk with her and ask her to be positive, because you're just 30, you have more than 30 to 40 years are waiting for you, so you can definitely bring back your gold and everything if you work hard with your home with a positive mind. And of course, the medicine I just given her was Netromor itself, not sepia, but the body is hot. She's a hot, having thermals are very hot, and because of these problems, there is a problem in the life, and that is the love failure is there in the home, because there is always the patient is being criticized by the mother. All these things I think will make the patient in that way. That's the reason why she is having this problem. I just asked her to check the thyroid function test also, as well as she is at very extreme anemic. So I just asked her to eat some more vegetables and fruits. And not only that, she was asked to take food in a regular habit. That she sometimes skip the food also. She used to scold his children whenever possible, because that is a result of this frustration. Even though she had three children, all of them are boys, but still there is a problem in her home. So these are the things I would like to share with you. In those conditions, homeopathy can definitely, I hope that when she will come back for after 15 days, definitely she will have a weight gain of minimum 2 kilos. Not only because our medicine can do such wonders, because I have noted all those kind of changes in almost all cases. What's your opinion on that, Dr. Huda?
Yeah, you are
Neck
audible
is
now.
shaking.
You can speak now. Now
No,
it's audible.
that time I cannot go. I could not go through the case in detail.
Okay.
That's why I cannot say.
Okay. Dr. Lata, do you want to say anything at this juncture?
Doctor, in between, Dr. Hariharan raised hand. If he's here, Dr. Hariharan, he's here only. Please unmute yourself and talk. You raised hand, I have seen.
Just my, it is myself. Let us invite Aryan sir. Are you there? Sir, you can present a case, simply a case for the time being, because Dr. AAMIR Malik is not joined, sir. No, Aryan doctor is not there in the list now. Everybody has some problem in the net. That may be the reason people are not joining. Dr. Leta, you want to speak something?
Yeah, I want to discuss one case of dyspnea. Male patient, 60 years old, having allergic rhinitis and itching eyes, and BP 140 above, near to 150, 90, and always pulse rate is 103. Like that. So I want discussion from that case. What are the suggestions from your side?
Yeah, whether it be about whatever be the case, it doesn't matter much. What matters is the case itself. Whether the
Yeah.
patient is hot or chilly.
Yeah, patient is chilly.
Chilly. Whether she takes food, hot or hot food, whether she
Hot
like
food, hot food and hot water, very
whether
high.
whether she is thirsty or not.
Not she, he,
Hmm.
male patient, doctor.
Okay.
Male patient. Okay.
What's the age?
Pardon?
What is the age?
Age 60.
60.
Yeah.
Who are how long since he is suffering from this problem?
From 20 years of dyspnea.
No,
And
whether he is you mean dyspnea by respiratory dyspnea or by palpitation? Whether the patient is
only
having dyspnea when he walks
no,
about or simply sitting down?
doctor, it is simply related with the respiratory only. There is no relation with the pulse increase or anything. That
So,
time only palpitation or nothing. Only
which climate do more damage to him? Whether it is the hot climate or the cold climate?
Cold climate aggravation,
Okay.
mostly.
Whether the patient is very angry during this problem, or he is simply sitting.
Yeah, very angry, irritated.
Yes, yes.
And yeah.
Who are the members there in the family?
6 members.
6 members. Whether his wife, his children.
Wife, children,
Whether he was an employee,
grandchildren.
whether he was an employee or an agriculture
Employee.
employee. doing a high level law job or
Moderate, average,
okay.
not a high.
On this case, what I feel that he may be an Naxomica patient by all.
Yeah,
And that the Naxomica can do wonders for him. And if you
yeah,
you can do either
yeah,
you can start with the Naxomica 6 or 30
yeah.
daily
I
daily
started that case. Yeah, that case I give uh, 6 potency started.
Okay.
But there is no improvement. Still 3 months I
Then you
giving.
say whether you change the potency or not.
No, I am not.
Then
Still now I am not.
in those cases, if there is no change, then you can give a dose of sulfur and then you can continue with the Naxomica in the next potency.
Yeah,
That may give the or otherwise you can give a dose of tuberculinum. Then you can
pardon?
go ahead.
Tuberculina.
Yes,
Okay.
then you can continue with the same medicine.
Tuberculina, which potency?
You can give either 1 potency or 200 potency, whichever you
Oh,
like.
okay. And
Then,
I think the severe chronic dyspnea patient having the not fully good health, in that condition, tuberculin is not advisable. Better to give such condition bacillinum that I read in some book. So
yes,
I ask you,
yes, when there is a damage in the lungs, if you find some kind of cavities or something like that, then you can go ahead with the bacillinum. Otherwise, you can go ahead with the same tuberculum.
okay,
And
okay,
tuberculum will not do much damage as you expect because our medicines are such a thing which will do better to the patient and not to uh, you know the purpose of our
comfortable.
medicine is not
Yeah,
to make any damage to the patient. So don't
okay,
worry. You can
okay,
directly because we no such
okay.
no such prejudice view is not required here.
Yeah, but in temporary relief.
Dr. Amir Malik
But,
has joined.
Yes,
okay, it's
Okay,
all right.
doctor, let him.
Okay, thank you.
you may invite once again. Just
No problem, it's all right.
No.
Okay, thank you.
Dr. Amir Malik.
please raise. Let's check.
Is there?
Yes. Amir Malik is there. Yes, he's opening his video. Somewhere in the dark city. That may be the reason. The electricity may be not be there.
Dr. Amir Malik, we all are waiting for you for a long time and we are discussing something else. Hello, where are you?
Yes, he's there, but in the dark. That means some.
Doctor, can you unmute yourself and talk, please?
Now I'm unmute. Hello, good evening, namaskaram, greetings. Critical sorry for the situation. I'm driving car. Reason is this:
Yes, sir.
suddenly light has gone. And first of all, a grand sorry to all of our doctors and members. Why I am not
It
able
is
to
not
come.
acceptable, doctor, because you you don't travel while you are taking the classes. You should be in a place and take classes.
Yep, I'm telling you, Honorable Dr. Ajni, what happened? The light had been gone
Okay.
at 7:20. And
Okay.
I have changed my residence. The problem is that there is no signals and there is a lot of sound out of there. So I just come out of from the home, take my car, just give the session.
Oh,
And now
very
what
good.
happened? It's 10 minutes. I'm driving the car. I'm in the car. You can see, and just going to home again because the light come back. Suddenly the storm comes. This is the reason. So net is gone, light is gone, And mobile data, it's not,
Okay, doctor.
I don't know.
And you can speak without
So just, I mean,
you may speak without video so that we can
yeah.
okay
I don't know how,
Dr. AAMIR
and my
Malik is
Wi-Fi is not working.
AAPH representative of Pakistan, and now he got his article is published in
Home was sold, and I've
paper.
changed the residence in that place where I come. The problem is that the signal is not
No,
there.
no, I'm just
Always there is a lot of problem. So mobile,
let him join it. I
yes
think
yes this is the problem with this kind of conditions. The climate, Pakistani climate is not good.
yeah, we'll discuss about some headache or something like that, different kinds of headache, so everyone can participate.
Somebody, okay,
share.
Doctor, you
I can-
better come up
I
with
can
a
share
presentation.
some.
Okay, very
let
good,
us
very
meet
good.
Okay, that is nice.
Very good.
now.
You may go ahead, doctor.
Yeah, this is a. Let us have a small discussion about the effects of excessive cortisol in our body. It is an important hormone. We know that most of the cases, whenever we see some cases, we don't know that what is the reason why he is weak in his body activities, why there is chronic weakness, why there is hypertension, why there is depression, why there is hunger, over hunger, why there is arthritis, why there is migraines, tunnel vision, sleep deprivation, acid reflux disease. These are some of the conditions we can see when there is excessive cortisol production. We know that some of the hormones, which is very essential for us to maintain our system. Cortisol. Most of our cases, when we are seeing the diabetic cases, we may think that the blood sugar is rising and rising. We cannot control it, even though there is the production of insulin is normal or more than enough. Most of the time, we are thinking about the production of insulin. But this is another, we know that all the hormones except insulin, these are all producing sugar more in our body. Excessive sugar in our body may lead to several symptoms. We know that one of the reasons for it is the overproduction of cortisol. These are other symptoms. We can see that heightened memory and attention, suppress the immune system, cortisol, increase in blood pressure, decrease sensitivity to pain, decrease serotonin. These are, we may see in most of the common chronic diseases, if the one hormone which is abnormally produced, that time these symptoms we can see. Again, we go to the other thing. Decreased metabolism, we know that certain person taking food, normally taking food, but he is not having the energy to do his activities, or his body is loosening. Weight is without any reason going down and down. In this condition, we have to check whether the cortisol level is excessive. Chronic fatigue, we know that in arsenic acid force, China, camphor, picric acid. This in this medicines, lethargy and weakness. Why this weakness? Even a very small production of it is high, the cortisol production in the high, that time these conditions we can see. Other symptoms, we can see that hypertension. BP is racing, we cannot control it. Sometimes we do not think that this is the reason for hypertension. Why the reason? There are so many reasons are there. If one person is taking more food and cholesterol level is raised and his lumen of the blood vessels are thickened or thinning, blood flow is not normally going, that time also we can see that hypertension. But the other reason, another reason is cortisol production, excessive cortisol production. We may check that the BP is normal and the flow is normal. Blood flow, we can feel it through our pulse, taking the pulse. We can see that the other things are normal, but the heart is functioning normal and the heart is going normal.
Doctor,
At the same time, is it he reached? Whether he reached?
Yeah, yeah, Doctor.
Oh, then, okay. I'm
Thank you.
stopped.
Thank you for giving us a wonderful session. In the gap, it was very nice. And actually, never expected, but it was so wonderful. Dr. AAMIR Malik, are you comfortable now? Dr. Danesh, can you make him as a co-host? Dr. Danesh?
Hello, honorable doctors, members, the lovers of homeopaths. I'm sorry.
Yes, you can start now, sir, because now
Yep,
it is
yep.
already half an hour gone.
Yeah, extremely sorry for this because light has been gone, no internet, no Wi-Fi, and mobile data is also not properly working. So I just go out of the home and now come back because the lights comes. First of all, the last time and today, I am really sorry for the situation. It's not in my hand. I believe fate is against me. This is the reason. So today and the last time, what the topic I had to discuss with our honorable members of IFPH is about myself, my nerve lacerations. A new topic or chapter I think so had been added in my life because I personally suffered this injury, and the symptoms and the treatment what I have got and received, I would like to share with the doctors because I believe if someone else suffer from the nerve lacerations, the main thing, the nerve lacerations either due to the trauma, due to the RSA, due to the X or knife injury, deep cut due from any metal or any glass pieces, and what are symptoms which I have to discuss briefly with all of our doctors. What I have suffered, the initial 45 days after the nerve lacerations, the citizen shows a hemorrhage in the left temporal region. And the finding of the neurophysicians and doctors and vascular surgeon is that this is the laceration of arteries and veins and vascular damage, which will cover with the passage of time 9 months or maybe take 1 year. But initially, after 24 hours, having the hard bandage on my brain, what they have found that there is a vascular damage of arteries, so you have to go to vascular surgeon and see for some kind of surgery, whatever it is. So after 48 hours of my injuries, I have visited to vascular surgeon, and his finding is that the only one main artery, he have to knot it. And because after time, after 5 6 months, the circulation itself will be balanced. The vascular system is very vast in the body, in the brain. Even when we walk, the blood makes the flow regular on the both side of the brains. So you have to go for this. So during that 4 months, the first 4 months, my injury had been done on 18 November, and you can calculate it more than 6 months. Initial 4 months, very critical. There is no desire of vertigoness. My balance is not okay. There is some slurred language also. I cannot understand what is that symptoms, why they are not getting better and controlled. According to the neurosurgeons, physicians, you have to take only B12, which develop the connective tissues. And there is no kind of any prevention or precautions that you are not allowed to sleep on left side, and you don't have to lift the weight. I'm critically damaged by their attitude. All physicians. I have visited around about 7 to 8 neurophysicians and vascular surgeons. They have one remark that you will be recovered with the passage of time. They are not giving me any medicine. In the initial 3 months, they give me drips, some antibiotics, some painkillers, and after that, a very famous painkiller made by opium. They give me that. If you have pain, you can take that. So I was so shocked that what is the treatment they are giving to the patients which are suffering from nerve lacerations, because they have no medicine for the vertigoneous, for the that symptoms of irregular circulation, the feeling of irregular circulation within the brain, especially backside left temporal region, where the master gland, pituitary gland is there, that place, and the medulla oblongata, the oxygen powerhouse of the brain. So I started treat myself how which medicines which I take to get rid of those symptoms. I will begin from the start. The first thing after 2 months is that the pressure and the flow of blood is not balanced, totally not balanced. What I feel when I try to walk, I feel a rush of blood on my backside, which travels to my front left half region of the face, and it will travels towards neck and towards heart. When I sleep, my left hand is get filled by blood. So very uncomfortable feeling, and I've taken one very good prescription given by Honorable Sir Dr. Shajikuddin. Sir advised me to take Metronsulf, Arnica, and one more medicine. It's a very good group of medicines for the injury, for the trauma, but the medicines are not giving me a result, effectiveness in the symptom. So I have to plan a treatment, how to overcome these symptoms, especially the balance of the body, the slurred language, the vertigoneous, and the imbalanced flow of the blood on the left side, which is very important. So I started with the, I feel that the vascular pressure, after having because I have a very critical bleeding, around about 3 liters blood. So what happened? Remember, this is my experience in 5 months. When there is a history of trauma, when there is a history of RSA, roadside accident, and when there is a brain injury, the pressure, the vascular pressure, the pressure within the arteries and veins, the flow of blood and the pressure is not balanced. Due to this reason, because this is the left side, left temporal region, the pituitary gland cannot give the proper secretions, what I feel. Because what I have done, I have taken pituitary 200 on daily basis, one dose. The immediate effect of pituitary 200, because it was not mentioned in our materia medica that in the brain injury you can use the pituitary. Because when brain injury is there, arnica is there, so many medicines there too. Natrum sulf is there, very good medicines. And the chronic of arnica is calcarea carp. This is my experience before this trauma, that calcarea is the chronic of arnica. But I have found one new medicine that is chronic of more than calcarea. If the arteries and veins are damaged, because the main artery which was cutted due to that laceration, that is the main artery. If it was not stopped or stitched within 30 minutes, the human will be died. So it's a miracle of God. First of all, I have survived because there is work for the humanity. God decided to give me time and it heals me. So I have started with the pituitary. What benefit that medicine give to me, and I was surprised that your for the mood variation and during the surgeries, they use the dopamine hormone, which was secreted by pituitary gland. And dopamine gives you energy, gives you happiness, gives a relaxation to nerves. It's a very big thing. To get these kind of hormones within the brain that which can fight with the trauma, which can give energy and oxygen level to brain, that you can neutralize and overcome the trauma situation. So what is that? Pituitary, I have started pituitary 200, and one dose give me a blessing of God that all the pressures within the arteries and veins uh, incredibly get better, improved. How? The sounds like tinnitus, the vertigoness, and the all another symptoms, especially when I walked, I feel the grip of the foots are not good. All these symptoms just you can say I get rid of within 4 hours of the first of the pituitary 200. So there is another step after taking pituitary. Physically and mentally, I will become active, and I'm very much happy to have these symptoms. And second thing is, for 4 hours, I have not feel any bad circulation or irregular circulation within my brain and left temporal region and left eye. So for 7 to 10 days, I have on pituitary 200, and I'm improving. The symptoms are reduced. But again, after 4 hours or 6 hours, something is again striking my brain. What is that? The suddenly throbbing and the blood circulation, I feel imbalance. I'm so much worried. What is that? And but that is that symptom that the left temporal, this region where we wear glasses, the clamp comes to this side. This part is swelled. There is edema on this side. So I've again visited to neurophysician why this edema is not going. My CT scan, either whatever it is showing that it will be healed by the time. This is only the circulation issue. You have to wait. So again, I think of the arnica and taking start. But arnica, I don't know. It's a best medicine for my brain, but it's not giving me response. So I have studied a lot of medicines, and God guide me one very good medicine, which is the chronic of arnica, which is the chronic of calcarea carp, that is acid mure, acid sulfuric acid. Acid self, there is, I cannot explain in words that I can never think that acid self can work on dead arteries, which are become purple and blue. There is no oxygen, there is no flow, and there is edema. So I have just taken acid self and gone to 200 and then 1 in just 2 months. So after there is no edema on the left side. The left temporal region, there is no. I'm very happy. My all skills, my all intelligence come back, and I have to share this. medicines which have a miraculous results when there is a neural nerve damage of the brain is involved. I believe the brain is a very, very, very sensitive area of the human. There is no need if you want to hit some person just on the brain and he will be no more. Very few people who can survive. More sensitive, and your all skill depend on the brain. So what I found, cephalinum. I don't know how to explain scientifically in words that cephalinum is used for to syphilis section, and I have to say these words for cephalinum, that it is the king of brain injury medicine. When there is a brain injury involved, and believe me, you immediately give the cephalinum 200 doses, the initial 5-7 days, and then medicine, which give me a catalytic effect on my brain. The responses, the language, the thinking, the blink, because I, so by blessing of God, that I feel when I think there is my very good energy of my brain. I even once the thing and it got stamped in my brain. That skill is get. So I take zinc metallicum. That why my brain is not working so fast, why it's not as quickly as what I want. It just not responding to me. The power is not back to me, especially the brain speed. So second, first is the cephalinum and second is the zinc metallicum. Then I have take only one dose zinc metallicum, but in high potency 10 mg. That just 7 days I have taken and I'm feeling very much better. Now again, the duration of all my working capability of the brain and body is not improving. It is very slow. And why it is this? I will let you share, being a doctor, that after having the trauma, the blood circulation of whole body will take more than 5 to 6 months to get regulated. Because if the patient is bleed heavily, about 2, 3, 4 liters blood was drained, so the body cannot pick the circulation again. Either whatever you are doing, walk, you are doing some physical work, but it is a precaution which I have learned from my disease, that when there is a brain injury, please avoid the physical and heavy weight work. Don't do that. It will cause that damage again to the brain. So in the food, I have found the juice, the best one, the juices. Either it is of the raw juice, apple juice, orange juice, whatever it is. The juices give a very happy and relaxation to the brain and nerves, and there is a very good brain working, and we feel very light. Your brain, you feel your brain very light, that it's working properly. It's a feel like that. So third thing, the acid self-medicine. And fourth, ginkgo biloba. Because when they said nerve laceration will take 6 to 1 year to recover. And what happened, nerve lacerations, how it explain the symptom. I'm talking to you, suddenly on one word I got stuck. As I have to say Suzuki, a name of a brand, a car. So Suzuki, and it stopped. This is nerve break symptoms, that your nerve is break and the message is not transferring. So again, I have taken methicobal in Western, but I always believe we have all things, but we have to approach our homeopathic medicine system. So I have started ginkgo biloba, because for the autistic children's, ginkgo biloba is a fossil tree, and that tree was worshipped by all Japanese, and that tree have a very miraculous results. I'm very happy, and I've started ginkgo biloba. I have found 200 vanam and mother tincture. All these have a good effect, but very best effect of 200 and vanam. It gave me a lot of recovery. That when I got stuck on some words, it is just disappear in 3 weeks. So all what is that? I believe it's only external damage of the brain. We have to think for those patients which have the internal hemorrhage and the white matter oozes out from the ear, from the nose. Because when I was there for the CT scans, I have found those patients. I am thinking that I am just damaged externally and I'm suffering all this. So the patients who suffered the internal hemorrhage and white matter is oozes from the brain, gray matter and white matter, gyrus and cells of the brain. So what happened to them? So I believe in Western, or in the whole world, I found this, that there is no good medicine for the nervous system for that kind of critical injuries they have. Believe me, I have found the most senior in the Punjab, Lahore, the neurophysician who have a very big name, and their conclusion for these kind of injuries is zero. It stands on zero. So I said to them that I'm a doctor. I introduce every doctor that I'm a doctor. But I'm found that you peoples are the cause who are increasing the disease of the patient. You are not controlling the situation because they are helpless. Believe me, they are helpless. If that neuro community, the psychiatric community, they have to sit with us, because please money on the parents. You have nothing to give. You can treat them with which what things, which the oxygen, which the what you do, and there's no guarantee of it. They take the consent and said maybe you will come back or not. So this is a very big issue. Our homeopathic doctors and all our communities get together also for kind of patients. Please come to us. A lot of medicine for these kind of injuries and damages. And this is my personal experience, because I have never used cephlinum for the brain injury trauma. I am always on arnica and thuja, and I was really shocked that cephlinum is giving. I am on zinc for the vital awakening in the patient, but I was again surprised that zinc only not give the awakening of the vital signs. It also recover and over the nerve damage. So number three, acid self. Believe me, it is the chronic for mechanical care. You can imagine that the purple bruise, which was also covered remarkable arnica, is very fast. The catalyst recovering from SM. So this, my 6 months experience on myself. This time myself experience with sharing with all of my doctors. So God heal, God bless me, and I'm back. I'm thankful to God for all this healing and all prayers for our doctors of IFPH and members, because Honorable Sir CFK, Dr. Jikhode, Honorable Sir Abdul Salam, Dr. Danish, Honorable Doctors, Honorable Dr. Ajni, Honorable Dr. More, all of doctors pray for me. They support me either not from morally and ecologically, but also financially. They support me in bad time. So I'm always thankful to IFPH. Words are not enough. My services will never be, you can say, ended for the IFPH. I wish and I pray to serve IFPH doctors and the humans which are suffering these kind of issues, because I believe in neuro, they can't solution. They can't give solution because they have nothing like arnica, nothing like cephlinum. You can't imagine. There is a one case more, just in short words. His same history. He just fall down from the bike. His head hits the big rock, and he you can say carelessly he not dealing with the pain that there is pain after that injury. And what happened after 6 months? Come brain tumor on his brain, and the reason is the blood clot. So that patient was converted to chemo. To avoid blood edema, that infection, because they take fluid and forgive for the CSF to check the infections. So that patient had ultimately he died because no treatment is available for him to recover that kind of injuries. So it's a very sensitive when the people hit it on the brain, be which conscious, have the CT scan and to see happen to. So because my all injuries on external level, because my skull is very big. It's all about the arteries and veins. So you can imagine one more very searchful you can have to share with you. Then there is a thickness of arteries and veins within the brain. You know, is that when you move, you feel there is a stiffness. Their natural elasticity of veins are not coming back. Very important point. The veins and arteries have a lot of elastic city when that you can move right and left. There is no stiffness, there is no pain. But when you have edema and injury or trauma, there is a stiffness. So what to do with that? Cadmium sulf, use in the batteries to recharge that carbon which recharged. Cadmium sulf have this ability that stiff arteries within the brain. Just you take 4 5 days and become null and relaxed. So amazing. So kindly just note down these medicines because it's my self experience on, and I'm very happy that I'm okay. I'm okay by 100 by 100. There is no symptom now, no symptom. Even I'm sleeping on left side for 5 months. I cannot sleep on left side. This is very important. And no surgeon had told you about this, that this is your question. You don't have to lay down on left side where the nerve laceration happens. One, the MS of Farooq Hospital in Lahore, Punjab. He is a lover of homeopathic. He is a lover of arsenic. He is a lover of calcarea carb. Why? Because daughter of that doctor, she have a ricket fits, and after using calcarea carb 6 months in 230 C, that fits normal. And again, he have found a very incredible result in food poison because I've met him 50 years before. And when I went to say homeopathic doctor, he said I'm a lot of arsenic rules the Western because it's a poison. And who had conference about homeopathy that arsenic is not is a poison. We are using poison, so they should understand philosophy. Our philosophy is followed by the people Alexander Fleming and Louis Pasteur, who discovered the vaccine. The concept of and make it a medicine is given by our father, Dr. Frederick Samuel Hahnemann. So Western should learn from us and must listen to us that what we want to say and what is our agenda. Our agenda is not to sell our medicines like Western, as Merck and Abbott have. Our agenda is to serve human without damage. What the rule is given by our father. So in the end, I have thankful to India, the government of India, the community of Indian doctors. You are doing a great work on. You are aware of homeopathic medicines land after our father, Germany, who discovered the homeopathic medicines. So all what you have given and doing for the humanity is very great because I am always a follower of my father's, Dr. Kashiram, Dr. Dolat Singh, Dr. Borak, and Dr. Frederick Samuel Hammond. I found them the legends of homeopaths. And there are a lot of more doctors. The words are not enough to praise all work quality and the legend of the homeopaths is India. So God bless you, sir, all of our doctors and members with lot of love. And if you have any question regarding the brain injury or the medicines, you may ask. It's my new experience in the brain medicine that I have learned, and maybe it's given by destiny that I have to work on this. Maybe this comes to me for this reason. The injury comes to me only this reason, but I'm very happy after having my health, mental health, brain health, and physical health. So,
Thank you,
God,
Dr. AAMIR Malik.
yeah,
Thank you so much.
welcome, welcome,
And
honorable doctor.
we are so happy to see you again in our webinar. Actually, when you are suffering from the head injury, we all were in a panic mode. Now it's a miracle, and it's a great happiness for IFPH. And Dr. AAMIR Malik from Pakistan is our pride, IFPH pride. And thank you so much for joining with us. Even though it is late, I think yesterday also we had same problem. Internet, poor
Yes.
internet connection of the Pakistan. I don't know what
Yeah,
is going on there.
always one more pride comes to this India. India is number one. He's working hard. I appreciate the heart and the truthness and the honesty I have found. It is not just I'm so feel bad saying that whatever our country is, they have to listen, learn from India.
Now also there is a glitches in your speech, doctor. It's not clear. Anyway, thank you so much. Now it is the time for the Malayalam session. We are moving to Malayalam session. Thank you so much. Come again. And those who need more details about the head injury, you can contact him to his number. It is mentioned in our, program chart. So you can contact him directly. And now I am inviting Dr. Mariamma John for moderating Malayalam session. Dr. Mariamma John, please.
ഡോക്ടറെ എല്ലാവർക്കും നമസ്കാരം.
God bless you all. Take care, everyone.
Dr. AAMIR Malik, we are very happy to see you again.
Thank you very much, honorable doctor. It's a miracle of God because I believe I don't. It's a big injury, a lot of blood oozes. But I'm very much thankful to God and all our doctors and members who pray for me, who host me, that I come back with my all skills and energy. It's a blessing of God.
We all prayed for you, doctor.
Yes, sir.
Deeply
Yes,
prayed
sir.
for you. Thank you, doctor.
It's
We are
great,
very happy
great
to see you again
news.
in our platform.
Yeah, I missed IFPH. Of course, I have planned in future that someday I will dinner in Malayalam, whatever, in Kerala, in India, in Mumbai. I have to see Shri Amitabh Ji. I have to see all our Bollywood actors, Hollywood actors. It's my also prayer since my childhood that I have seen because I love all the traditions and the way of living. What one day we will meet in either in India, either in Dubai, either in Kerala, either in Malayalam, wherever. That's my prayer to God. I'm
Thank
thankful
you,
to
doctor.
you.
Now we are starting Malayalam section. Thank you.
Thank you.